Did you know that we have no evidence to support the traditional apprenticeship model of clinical teaching, with one faculty responsible for 8 to 10 students providing patient care in the clinical setting? This may be one reason that the majority of graduate nurses are not practice ready, possessing expected levels of clinical judgment. Today, in Part 5 of this series on developing clinical judgment, we will discuss educational best practice strategies to develop clinical judgment in the clinical setting. I have a simple question to ask you as a nurse educator. How can you read a student's mind and determine if they really understand what they have been taught and are safe to provide patient care? Ask the right questions. By asking the right questions during clinical as well as afterward in post-conference, faculty can easily develop the clinical judgment skill of reflection on each nursing action that will strengthen clinical judgment and improve clinical decision-making when they care for future patients. But these questions need a best practice framework to ensure practice readiness. And the two frameworks to guide the reflection questions that nurses use while providing care, as well as in post-conference, are the nursing process and Tanner's clinical judgment model that was discussed at length in Part 1 and Part 2 of this series. Let's begin with the first step of nursing process, as well as Tanner's framework, assessment of nursing process, and noticing of Tanner's framework of clinical reasoning. The first question, what clinical data do you notice that is concerning to the nurse? And then we establish the nursing priority by interpreting the data. Second step of Tanner's framework of what does this concerning clinical data mean? And then next, reflect and ask yourself while providing care, what additional information or clinical data do you need to collect as the nurse to ensure that you make a correct clinical judgment? Then we move to planning of nursing process and the responding of Tanner's framework, which is simply this question. Based on your interpretation of clinical data collected, what is the nursing priority that will guide your plan of care? And then what interventions will you implement based on the current nursing priority? And then finally, evaluation of the nursing process and reflection of Tanner. The next question is, what is the expected patient response or outcomes to the nursing plan of care? And then finally, to evaluate, did your patient respond as expected or not? Then going back, what did you notice? As well as nursing process of assessment. It's an iterative, repetitive cycle. And this is just a very practical strategy that we can use to confidently develop the clinical judgment in our students. And if you'd like to learn more on strengthening clinical judgment in your program and with your students, I just published a helpful resource. It's called A Faculty Guide to Develop Clinical Judgment. And there's a link in this video, so check it out. I also have a free clinical reasoning case study to download on my website, KeithRN.com, to get your students practicing this nurse thinking skill of clinical reasoning. And if you found this content helpful, be sure to subscribe to my YouTube channel, Think Like a Nurse, and don't miss the next video coming shortly in this series that will help you to develop clinical judgment using simulation. I look forward to connecting with you then, and thanks for watching.